One of the great things about modern medicine is how much it changes. One idea may seem completely ridiculous, and then a few years later, that idea is winning a Nobel Prize. Blood pressure, people may be surprised to know, is in fact one of those things that has changed, and their perspective on blood pressure, and elevated blood pressure in particular, has changed dramatically. In fact, it wasn't until the 1960s when randomized controlled trials demonstrated people with elevated blood pressure benefit from lowering the blood pressure. What did we think about lowering blood pressure before that? Well, not too highly. In fact, that's where there is the old term essential hypertension. It referred to the idea that as people got older, changes occurred to the organs, and the elevated blood pressure was a compensatory mechanism to keep the organs nice and perfused. It was thought the elevated blood pressure was a necessity, even essential, you might say. How do we know about this? Well, here are some quotes from wise old men who wrote quite a bit in the early 20th century. 1931, John Hay, a well-respected professor of medicine, wrote that there is some truth in the saying that the greatest danger to a man with high blood pressure lies in its discovery, because then some fool is certain to try and reduce it. P.D. White, perhaps the premier cardiologist of his day, also in 1931, wrote, hypertension may be an important compensatory mechanism which should not be tampered with, even were it certain that we could control it. A decade later, in 1949, Dr. Charles Friedberg's textbook, Disease of the Heart, stated, people with mild, benign hypertension defined as pressure of 210 over 100 need not be treated. Here is an excerpt from an editorial in the Archives of Internal Medicine in 1965. 1965, not too long ago. It is common experience that many patients live medically uneventful lives in spite of prolonged and considerable blood pressure elevation. It gets a little bit more intense a few paragraphs later. One needs only look back at the past 50 years to be amazed and deeply concerned at the worldwide enthusiasm generated by many proposed therapies for hypertension, which eventually met their deserved doom, oblivion. But just 2 years later, we get the first prospective randomized controlled trial clearly demonstrating the benefit of lowering blood pressure in patients with asymptomatic hypertension, and the medical world would change forever, albeit a bit slowly. If you want to hear the whole story, take a listen to the episode on mechanism of action.